It is dark and sometimes invisible. This epidemic of suicide is a major public health concern and is among the leading causes of death in the United States. And now a new lifeline is on the horizon. 988 is a number designated as a new 3-digit dialing code to connect anyone in need of a counselor. That service is expected to launch in just a few days, but how will it be implemented and will people be receptive? ABC's Trevor Ault takes us to the windswept plains of Wyoming, where people are hopeful this new service will save lives.
I've never been angry at my son. I've always been angry at me.
The seconds pass inevitably. This year, Lyle Nyberger should be 33. Instead, he stays 17, forever frozen in the memory of his father, Lance.
As you get into it and talk to other people, all of them say, we're in a life we never wanted to have. We're all in the cowboy up attitude. You know, real men don't cry. Real men don't have problems.
Was that something that you subscribe to?
You know, it's inbred into me. We all have problems. We all have something go wrong, and we all need help at times. And when you learn that you don't need help and you just go on, maybe that makes life a lot tougher.
They say in Wyoming there's 2 seasons, winter and wind. Sometimes bitter and biting, others just a whisper. But when you're here, you feel it. And these days, the same can be said about suicide. In a region known morbidly as the Suicide Belt, Wyoming has the highest rate in America. Its impact so widespread, it feels as present as the wind.
Okay, and I'm Lance Nyberger. I'm the chair of the task force, and again, thank you for being here.
The Natrona County Suicide Prevention Task Force is well aware of the problem. They meet once a month in Casper to plan events, pool resources, and keep track of the lives lost. Top of mind today, another first responder has died by suicide.
Well, 2 days ago, we had our 6th for the year, and it was a first responder on duty. That's a big number in a year to have that happen.
There's a number of factors putting Wyoming at high risk. Many residents are isolated. And with more guns per capita than anywhere else in America, residents have more access to lethal firearms than mental health professionals. One University of Utah study posits the altitude could be a factor. According to a Gallup poll, the Mountain West is home to some of the happiest Americans, and yet it consistently has higher rates of depression and suicide.
Year to date last year, my officers had responded to 256 persons who were considering suicide. And this year, we have seen an absolute negligible change. And so year to date from May 15th, 253.
Here in Casper, Wyoming's second largest city, police respond to suicide calls twice as often as they do for shoplifting. 16 years ago, one of those calls came from Lance when he found Lyle at home. Lance had no idea his son was suicidal. No note was left behind.
How often do you think about Lyle?
Daily. There isn't a day that goes by that I don't think about him. Now, after his death, you know, it was horrible. And I came to a point where I realized that it was Lyle's decision and his decision only.
In this area, this is a widespread problem. Why do you think that is?
There's a lot of things going on. One of them is Wyoming's a rural state.
By landmass, Wyoming is the 10th largest state in the country. By population, it's the smallest, meaning even if you wanted help, help might be a long way from you.
This is what you see in most of Wyoming. You'll hit a major town about every 100 miles. And when I say major town, I mean a town of 5,000 people. You might get a call from somebody that's, 100 miles away from the nearest town. But you might also just not have mental health professionals. Wyoming has been a mental health shortage area, always.
Now, federal legislation to help any American in crisis reach a counselor by phone is set to launch July 16th. But in this state, even that will be an uphill climb to adopt.
I'm familiar with 911. What's 988?
So 988 will be the new 3-digit number for the suicide lifeline.
What does that mean specifically for Wyoming?
You're not going to find a cell tower every 50 miles or so here. And so making sure that we are meeting those infrastructure challenges is probably going to be our biggest, most expensive long-term project.
988 is being touted as a one-stop shop for anyone experiencing a mental health crisis. But funding the project so that healthcare providers are ready for the influx of calls is proving to be challenging. The Department of Health and Human Services expects the volume of calls to double within the first year. However, according to the National Alliance on Mental Illness, only 4 states have enacted a concrete plan for funding. The Central Wyoming Counseling Center is one of just 2 suicide hotline centers already up and running in Wyoming. It opened just 2 years ago. The workers there know this state's layout, its culture, its resources or lack thereof, all of which is essential in a crisis.
CWCC Suicide Lifeline, may I help you?
They've secured $2.1 million to expand the suicide hotline into a 24-hour service.
I'm glad you called today.
Most of it federal money from the American Rescue Plan Act that Governor Mark Gordon appropriated. But with the state legislature refusing to expand Medicaid, that federal funding will soon run out.
There's still a lot of work to make sure it's prepared for the rollout.
Absolutely.
Then the funding also runs out
Absolutely.
in 2 years.
Yep, we're going to be very busy the next year.
So what happens if, hypothetically, a person is 150 miles from the nearest crisis center or hospital, and they call because they're in a crisis?
Well, we roll out what we have in the area. Well, which might, if they need that level, if there's an imminent risk of death by suicide and law enforcement presence is needed, then we'll roll them out.
Around Casper, that happens often. As we sit down with Police Chief Keith McFeeters, he tells us his officers are responding to a suicide call as we speak.
The state of Wyoming is very much deeply indoctrinated in what I would describe as the cowboy culture. There's a cowboy code of ethics that really embodies, look, whatever the world can throw at me, I can find my way through this. But suicide and mental health are things that you may not be able to just kind of pull yourself up by the bootstraps and see your way through.
With this culture, it can be a bit like the fact you can lead a horse to water, but you can't make him drink.
It's my job then to put water everywhere I can. I can make enough resources available to them that at least they know where to find it.
And many who know the depths of suicide firsthand refuse to treat it as a foregone conclusion.
It's like you living in this negative, I guess, self-made hell.
Jason Whitmire attempted suicide some 10 years ago. He now works with Lance on the task force to stop others from doing the same.
I would imagine that there's a bond that you would have with people that know these dark depths.
Yeah, there is. But you don't get that feeling until you know their story. You can't bond if you don't know what they're into.
That's something Lance Nyberger still thinks about when he reflects on the loss of his son.
He didn't feel comfortable enough to come to me and say, Dad, life's kicking my butt. I'm really struggling here. And at the time of his death, when he needed me the most, I wasn't there for him because we were going in opposite directions instead of working together.
The messages that you give to someone who's lost someone close to them, that kindness that you extend to help them deal with that, do you extend the same kindness to yourself?
I've gotten better at it. For about 6 months, I didn't care whether I lived or died. It wasn't until our daughter gave birth about 7, 8 years ago to our granddaughter, I really realized what I would have missed had I not lived back then.
Wyoming has been referred to as just a small town with unusually long streets. And here, everyone seems to know someone who's dealt with suicide. For Lance, there's both horror and strength in that sentiment, that everybody is dealing with something, that pain is a universal burden we carry. But what Lance has learned is with a little effort and an open heart, it's possible to help others lighten the load.
Used to come out quite a bit right after his death. You realize that a sudden death like this, you can just wipe out everything else. You know, he's going to be 17 forever.
Is that what fuels you to keep up with the work?
It is. You know, that's what keeps me going. My faith and the fact that I truly believe I'll see him again someday. I'll be with him, and that's what's given me the hope to continue.
988, a bit of a lasso to try to curb the downside of that cowboy culture. Our thanks to Trevor. If you or someone that you know needs help, remember you are not alone. You can also call the National Suicide Prevention Lifeline right now at 800-273-TALK. 988 launches on Saturday.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.